Good afternoon, everybody. We have a lot to talk about today, so I have a lot of backup, which I need, which is Deirdre, and Melissa, and Josh, and Paul. I want to talk a little bit about where we are in COVID. A lot is happening, spending a lot of time talking to fellow governors, and then talk how that is impacting our economy, because the two are very closely related. A quick snapshot since yesterday. You should see that we continue to do a lot of PCR testing, 22,000. The positivity rate of 2.3%. I can say that's a lot better than where we were a couple of days ago. I can tell you it's not a lot more than where we were a couple of months ago. Take that for what it is. It's trending up in a slightly controlled way, I'd like to think. Fatalities, 2. Hospitalizations, 19. Hospitalizations are up. As you remember, infections are a leading indicator, and hospitalizations lag a little bit. They are up 232. Some of our highest we've had in a couple of months. Remember, at our worst, we were at 2,000 COVID-related hospitalizations. A couple of things have changed on hospitalizations in the last 6 months, which you should probably know about. Back then, about a third of our people that went to the hospital ended up in the ICU, intensive care. Today, it's not 1/3, but it's 20%. I think that shows that we have some better therapies and we're screening people earlier, which is a real positive. Back then, probably 22% of the folks who ended up in the ICU, they were fatal. Today, it's 6%. So you see where, again, they're making incredible progress when it comes to keeping people alive and keeping people out of the ICU. The average age of fatality is still about, or median age is still about 80. So the demographics have not changed quite as dramatically when it comes to hospitalizations as maybe we could have anticipated before. This next chart is the one we said we're going to release every Thursday, and it gives you an idea of what the spread is like in our state. And obviously, if you're in the gray, you have as few cases as we've had in a long time. Most of Litchfield County is looking pretty good. A lot of Fairfield County was pretty good. Norwalk and Fairfield are flared up. You can see if you got really good glasses, they're red. This is a little bit like a mirror image from where we were in May when Fairfield County was on fire and southeast Connecticut was not hit very hard. Today you see most of the red is in that area of southeastern Connecticut. I can tell you those areas that are in the red alert, 15 plus cases per 100,000 on a daily basis. We've gone from 11 to 19 towns. So you can see it is continuing to extend yet again. But there is some progress. New London and Norwich and Danbury are continuing the trend down. So when we bring in the rapid response and over a period of time, I think we are able to get this contained. Danbury, again, that's not going to be red next week if we're doing our job and if everybody's maintaining the discipline there. And that is not spreading to its neighboring towns. So I take that as a very good news. By the same token, Norwalk and Fairfield down there in lower Fairfield County, they are more like a hockey stick. So those are the two sides of the equation. I could just tell you on this next chart, this is what our recommendations are. First of all, in the darker blue, East Hartford, Fairfield, Groton, Lisbon, Norwalk, Plainfield, Prospect, Salem, Waterbury, and Waterford are all the add-ons to our red alert list. Thankfully, East Lyme and Preston have gone off, so it's not static, but it is a reminder that it is expanding. What does the red alert mean? Let me just remind you. We noticed you, and Deirdre and Max were on with all the public health and mayors from those red alert towns, re-emphasizing if you're 65, stay home. Here we go again. No unnecessary travel. We're going to work on our be able to do the home delivery, the DoorDash, everything we can. Limit your meetings with non-family members, those that you're not very close to. I know we've got the holiday season coming up, but especially in these red alert areas where there's real community spread, special time to be very careful. Again, we have to pay extra attention to our nursing homes, and that's why we are ramping up our testing of staff at all of our nursing homes around the state and making a special priority for residents and visitors in our red alert areas. I'm a little surprised, by the way, that CMS, coming out of the federal government, continues to mandate visitations at nursing homes, saying you can't require testing for visitors to nursing homes. But I think Deirdre would back me up in saying it is a strong recommendation, especially in those red alert areas. If you care about the loved ones in the nursing homes, be strict about testing people before they go in and visit. As you know, towns can revert to phase 2. That sends a signal, I think, to some folks that this is serious and you're in a red alert town. Of that list here, I think only Windham has actually taken advantage of that, but it is an option. And I can't say this enough. The 3 W's: wear the mask, wash your hands, watch your distance. Let me change gears for a second, and Melissa's going to help us out with this, but there's been some press about it, and I thought it was worth describing. You know, we're learning all the time when it comes to COVID, and the only thing that changes as fast as COVID is the economics and the economic projections and what's going on in our region as regards the economy. And right now, it's relative good news. Thankfully, Melissa McCaw is very conservative in her projections. And we had thought, you know, going back a few months, we didn't know when this economy would start recovering. We didn't know when the stock market was going to be recovering. And we budgeted conservatively, and I really appreciate that. Today, where we have a little more history we can point to, it looks like our deficit won't be what we thought it could have been, a couple $2 billion, and it's down to, you know, about a 40% reduction on that, 1.2 or so. And that makes a big difference in terms of what we're thinking about for this fiscal year, which ends June 30. That's, I think, is good news. Why are we doing better than a lot of our peers, and why are we doing better than what we had just projected, you know, a few months ago? What's going on there? Well, our revenue has improved by $454 million compared to what we had projected a few months ago, and that's because we're still down from where we were a year ago, but we're up from what we had projected. And there are a couple of reasons for that. One, we have more people paying taxes. We've had tens of thousands of people move into the state of Connecticut. We're one of the magnet states. We're net loser going back a number of years where more people were leaving the state. Now they're coming in. They are paying sales tax. Some of them are beginning to pay a capital gains tax. A lot of that $295 million is paid for more by wealthy people because who would have thought back in April or May that the stock market would have doubled in the last 6 months, up 14% for the whole year. Those folks are going to be contributing a little more to our state. $160 million in sales and use tax, cigarette tax. Sales and use tax, again, we have more people paying it because our economy is coming back. And I think it was thoughtful of the state to extend or reform our sales tax so it also includes internet sales, not just bricks and mortar sales. And that really helped save us a fair amount of what could have been lost revenue in the sales tax side. On the flip side, we've reduced our costs by over $300 million compared to what we had anticipated earlier on in our budget projections. A lot of that, over half of that, is related to health care, is related to Medicaid. Some of that is due to some improved federal reimbursement we're getting that is tied to COVID. I don't know if that goes forever. It won't go forever. And some of that is because of some reforms that we're making, lower levels of service utilization. Some of that is people just nervous about going back into the emergency room or seeing their. So a lot of these services that have been put off should take place. We'll see whether there are any permanent reforms that bring down our health care costs, but that's generally good news. And finally, the mitigation plan, you see $125 billion in savings compared to what was budgeted before. I think a lot of that is Josh Jabal, Chief of Staff, you know, working across all of our different departments, trying to find efficiencies that could be long-lasting, not just short-term. We will see. I don't want to get ahead of myself here, but right now, compared to our peers in other states, our budget is in relatively a better position, and this can change pretty fast. The Connecticut employment picture is worth taking a look at as well. Just to show you that, during the depths of COVID back last April, we were down 83% of employment. That was an enormous unemployment hit to us. And you've seen that now we're back at over 93%, if you can watch that chart going out to September 20th. And that has a lot of meaning. A, that's the best in the Northeast. Our people have gone back to work more. Our downdraft down at 83% in April was a little less than our peers because we kept manufacturing open and outside construction, some things that you know about. But you'll see, and we can tell from Europe, that we'll see where that trend goes going forward. But it's good news for us if we can keep it going, keeping our economy going, and we can only keep our economy going if we keep COVID in check. This next chart, and then I won't bore you with any more of these detailed charts, is just gives you a little comparison to this recession compared to 1990 and 2001 and 2008. And the red line is our short history of the COVID recession. It is not your grandparents' traditional recession, where you can see goes down more gradually and up over a period of many months and years. In fact, you can see that 2008 recession, which is the green line, we only got back to 99% of full employment. You can see, again, red, that first 8 months that we've gone, a sharp downdraft. It's, some people call it a V-shaped a recovery, but it's a lot sharper than that, the San Andreas fault. But 93.3% is by no means something you can count on that trend going forward. I was on the phone with Europe today regarding some businesses, and they're moving into curfew. Infections are up by a factor of 10 compared to where they were before, and they're worried about further turning back their economy, which they're desperate not to do. So take nothing for granted, but this gives you an idea at least how we're doing economically, how we're doing compared to other recessions, and what our COVID response looks like on a statewide basis. So with that, Josh and Paul, Deirdre, Melissa, and I are happy to take your questions.
Channel 3 Eyewitness News.
Yes, Governor, I'd like to go back to hospitalizations if we could. What does the hospital capacity look like right now, and at what point do we need to be concerned about them filling back up?
Well, I'll start with that, and then somebody smarter can help me out. But right now, as you remember, in the bad old days, we had 2,000 COVID-related folks in our hospital rooms, and they were staying in there a longer period of time. Today, we're a little over 200, so we have a lot more capacity than we did before, and people are spending a little less time in the hospital, a little less likely to go to the ICU, which is, the most limited. We have some extra, people in the hospitals today related to elective surgeries, a lot of which were being put off in the early days. And there's something the hospitals have the ability to throttle a little bit based upon need going forward. But looking at hospital capacity is going to be very important to me over the next few months. Josh, Deirdre, anything to add to that?
Yeah, and just in terms of the statistics, statewide, a quarter of hospital beds in total are unutilized right now. And that's, as the governor said, without any actions being taken by the hospitals to free up beds from elective procedures or anything. And only about half of the ICU beds are occupied. So, although the trends on hospitalizations have been increasing, and we are watching that very carefully, as a percentage of our total hospital capacity, the number of COVID hospitalizations we have is still very low.
One other thing I would add is you might recall that the governor developed these COVID recovery facilities during the first wave of the pandemic. And one of the key functions of that was to allow people to be discharged from the hospital who needed to go to have some additional care, but didn't need a hospital level of care. We have kept those facilities available, And if needed, we can call on that capacity as well to help people get discharged from the hospital sooner if they need to be.
And Governor, going back to the red alert towns, the concentration for the third week in a row seems to be southeastern Connecticut. What, if anything, should the casinos be doing to help combat the spread? And are you satisfied with their approach right now so far?
I think I am. I mean, I don't think you see anything going from the casinos to Norwich. I worry more about community spread, perhaps infecting the casinos. My understanding, and Deirdre can help me out with this, is casinos are ramped up their testing significantly for employees and their families because everybody wants to avoid a flare-up there as possible.
NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. I was wondering, as you were saying before, it appears that only Wyndham has chosen to roll back to phase 2 at this point. If communities keep choosing not to fall back, would the alert system be rethought or refigured? Would it potentially require communities to do that?
Not yet, and not at 15 per 100,000, but if we had a higher intensity of infections, if we saw more community spread, if we thought it was impacting the region more, we'd have to take a second look at that. I don't think we're there yet.
Okay, and also, just depending on how many cities and towns are added to that list, would there be a tipping point where the entire state would have to return to phase 2?
Again, I think it would have to be a lot more intense than what you see, but as I was talking about Europe, they're doing more and more on a regional basis over there. And if you think that Europe maybe is a month ahead of us, I hope that's not the case. We're going to have to think as well. I mean, I spent a lot of time talking to Massachusetts, Rhode Island, New York, and New Jersey. We had taken a break from each other for a couple of months, but now we're talking again and hoping to God that while we keep transportation open between our respective areas, and I think we'll be able to announce something with Rhode Island and Massachusetts at some point soon. We're also thinking about what we have to do in terms of a response to COVID, if we have to do a unified response.
Okay, thank you.
News 8.
Hey, Governor, this is Eva with News 8. I hope you're doing well. I had a quick question in regards to nursing homes. I know that a lot of people are looking to nursing homes now. We're seeing that some nursing homes are actually taking it upon themselves now to actually do visitor testing. Do you see the state stepping in at all to make this a requirement as we're watching these numbers tick up, especially with these vulnerable populations?
Deirdre tells me the federal government won't let us do that. Deirdre?
Yes, so we would like to very strongly urge anyone visiting a nursing home to get tested. Some of the facilities are using antigen tests that were supplied by Health and Human Services, Federal Health and Human Services, to offer testing, rapid testing on site. We're distributing some of those Binax cards you heard the governor talk about last week or the week before. We're distributing some of those to nursing facilities. But if the facility where your loved one resides does not have that antigen testing available on site, we would strongly urge you to get tested before you visit your loved one. And of course, the mask and hygiene and distancing is really critical. Nursing facilities are very susceptible and vulnerable, as we've learned the hard way during this pandemic, to the infection being brought in, and it's very difficult to control once it's in the facility. So out of respect for our elderly residents and disabled residents in our nursing facilities, everyone who's visiting really should get tested and be super, super vigilant on the mask wearing and distancing.
Fox 61.
Good afternoon, Governor. Back to the red alert towns, and my question is this. For people who don't necessarily live in a red alert area, but go and work daily 8, 9, 10 hours a day in a red alert area, should they think about following the recommendations that you've laid out?
Well, the recommendations, yes, I would say. Remember, the recommendations are people over 65 stay close to home. You can go back to phase 2. So I'm trying to figure out exactly how it would impact somebody who works. But if you're saying, if you're in a red alert town, even if you're just working there, you should be as cautious as anybody that lives there, even more so, because you have the potential to bring that infection back to your home and your town.
And then I asked you this question a couple of months ago, and I want to ask it again in light of the new numbers. How possible is it that we're about to see holiday gatherings, we're about to see students returning from out-of-state colleges, we're going to have the election. There's the potential here for more spread and higher numbers here later on in the fall. How likely is it that our robust program of testing and tracing will allow us to avoid a shutdown like we had last spring?
We control what we can control. Just to be blunt about it, our behavior has a real impact on what goes on, and I think you see that over the last 6 months as Connecticut is really led in terms of wearing the mask and social distancing, the things that make a difference. But I can't promise you, look, Boston has an infection rate that's 3 times ours. Providence is pretty high. New York is doing pretty well, except for some areas. Look, we found out the hard way that this virus knows no borders, so we control as much of our destiny as we can. I'd like to think that we have learned so much more compared to 6 months ago. I think the therapies are better. I know the testing is better. I know we're doing 5 times more testing than we were before. It gives us a much better capability to get this virus earlier, contain it better. Is that 100% foolproof? No, but we're better positioned.
All right. Thank you, Governor.
WTIC 1080 News.
Hi, Dr. Gifford. I was wondering if you might want to clear up any confusion on herd immunity. My image of that was it had to do with vaccinations, not letting everybody in the world get sick. How do you explain that to people?
Well, there are 2 ways that we can become immune to an infectious disease. One is by having it, naturally occurring, catching the infection, recovering, and then having immunity. And the other is by an effective vaccination. The concept of herd immunity just means that enough people in the population are immune one way or another, that your odds of catching it are very, very low. Because most of the people you bump into will be immune and won't be sharing the infection. Herd immunity is not typically the way that an advanced society would manage a potentially preventable infectious disease that can cause hospitalizations and death. We try to prevent those hospitalizations and death. And then we develop and implement a vaccine, which is exactly the process that the governor is leading. So in order to have enough people in our population immune to COVID, we would either have to vaccinate them or see massive numbers of infection. So herd immunity in the absence of a vaccine is not really a viable option.
What percentage of the public would have to be immunized to get there, and how long could that take potentially?
Typically it depends on the effectiveness of the vaccination, of the vaccine. Typically the number you hear is around 80% to achieve herd immunity.
The Associated Press.
Thank you, Max. I was wondering, first of all, if you live in a red alert district town, how often should you get tested if you have no symptoms?
You want that one?
Sure. So there's no hard and fast recommendation there. Certainly if you have an exposure, a known exposure, you should wait a few days and then be tested. Wait at least 3 days. Around 5 is the best time to catch it. You should isolate yourself until you get yourself tested And then you also need to quarantine for the full 14 days if you have an exposure to a person who's known to have a COVID infection. So let me say that again, because this is such a critical part of our prevention strategy. If you have a known exposure to someone with a COVID infection, you need to stay home for 14 days, even if you have a negative test. So if you're living in one of these red alert communities, get a test if you have a known exposure. Get a test as often as once a week or once every other week if you feel like you want to confirm that you don't have COVID and that you're out and about, you have the potential for exposure. There's not a real hard and fast recommendation on the frequency of asymptomatic testing, but it's available to you. It's free of charge, and we're encouraging people that live in these communities, especially if they think they are at high risk of exposure, to get tested.
Thank you for that. And maybe, Doctor, could you answer this? Do we know how many COVID cases originated in schools? Have there been any? And has there been any proof or contact tracing that's shown that they've linked any of these cases to people who've been hospitalized or who've passed away?
So we have not seen cases where we believe the transmission is happening in the schools, with just a couple of exceptions. We have seen, obviously, and you've read about and we've talked about cases of people associated with schools that have gotten COVID, and then schools have closed and they've done the contact tracing and reopened. Those are cases we believe are existing because there's COVID in the community. But we have not seen cases where an entire classroom or an entire grade or an entire club of a school has transmitted COVID from one to the next. So that's very good news, and we think that's because students and staff and faculty and administrators are doing a really strong job of implementing the masking and the distancing and the cohorting in the Connecticut schools. And we're very grateful for that, and we think that's what's allowing our schools to remain open and functioning and have kids get the benefit of in-person education. In terms of hospitalizations, many hospitals are doing COVID testing on admission, both for emergency and elective admissions, so they're trying to minimize the number of people who have an unknown infection. Testing isn't 100%. There are people who eventually become positive even with a negative test. But we think the transmission from COVID-infected patients to staff in hospitals is very, very low.
Well, I'm sorry. I meant, though, you haven't had any cases where there's been someone that's been hospitalized because they've been infected by, say, a kid that went to school. Nothing like that has happened. Not that we're aware of, no. And Governor, I just wanted to ask you too: do you have a reaction to the Purdue Pharma their settlement with the Department of Justice, seeing as how they're a Connecticut company?
They are a Connecticut company, and OxyContin, badly abused, is killed millions in our country. And I'll let the lawyers fuss about the nature of the penalty and is it enough. But I do think it Sue speaks to sort of a failure of our healthcare system. It's not Purdue Pharma had OxyContin for people with severe pain. Then it was abused, widely distributed, overused. I don't know what happened to the distribution folks. Nobody stood up. The doctors were prescribing it. Nobody stood up. The hospitals knew about this. Nobody stood up. The insurance companies were paying for it. Everybody just sort of passed it along. So I don't want to be tough, Deirdre, but I do think it's a bit of an indictment of our health system. I don't know where the checks and balances were there. I'm glad they're going to pay a penalty, Sue, in terms of this particular incident. But I think we have to look at this healthcare system and see what we can do to make sure this never happens again.
Thank you very much.
Hearst, Connecticut Media.
Thanks, Max. Hi, Governor.
Welcome back.
It seems like I've been staying at the same desk for 7 months in a row. Could I ask Josh or Dr. Gifford to get a little more granular for me on the why Norwalk and Fairfield are on the list this week? I know we were talking about small gatherings in Danbury and Norwich, and we have the universities in Fairfield, but Norwalk is a bit of a surprise to me.
Josh?
DJ, you want to take it? Sure. So,
yeah, go ahead, Josh. I was just pulling up the numbers. You go ahead.
Sure. So for Fairfield, the analysis from the epidemiology team and local health is that the cases there seem to be quite concentrated in the two universities there, Fairfield University and Sacred Heart. Fortunately, in both cases, week to week, the number of cases has come down, and indeed in the town of Fairfield, the number of cases has come down, and the test positivity rate has gone down week to week. So hopefully that's trending in a more favorable direction, even though on a 2-week average, they are red. Norwalk is definitely more concerning. Norwalk case growth has been was very strong from week to week. 72 cases 2 weeks ago, 163 cases last week, with test positivity about 5% in Norwalk. So I know our team is working closely with the local health department there and the local officials. It sounds like it's a lot of the same type of activity we've been hearing about and seeing in Eastern Connecticut, other parts of the state, other parts of the country. Small gatherings, people letting their guard down, not wearing their masks, no individual event or events to point to specifically, but just general community spread. So really important that everyone in Norwalk and around the area take extra precautions and get tested, as Commissioner Gifford was talking about.
Thanks. And Commissioner, the new CDC guidelines, it seems like it's portrayed as a bigger deal than what it is. I mean, it's still a 15-minute exposure. It's just over a longer period. Is that the way I should understand it?
Yes, so the new CDC guidelines, they used to talk, the old guidelines talked about an exposure being defined as 15 consecutive minutes within 6 feet of someone who is known to have COVID. The change that was updated this week says 15 minutes over a 24-hour period. So multiple shorter exposures within a day to an individual with COVID could be classified as an exposure.
Thanks for explaining that in a way that I can understand. Hey, Governor, so can you just dropped this. I was talking to people in Europe about business today. What were you talking about? Who were you talking to?
Just stuff.
Is that a no comment?
Snow.
You're talking about snow? Jeez.
Let it go, Ken. We'll keep going.
I'm not going to play 20 questions. The other reporters behind me are, I'm sure, angry already. Hey, Josh, so maybe Melissa, are we seeing attrition savings yet on the people who are going to be retiring, or is that still another year and a half off?
Sure. So we haven't begun to see a significant uptick in retirements. I do think we're continuing to see the normal rate of retirement-related attrition. As we get closer to June of 2021, we expect to see that ramp up. Certainly, I think COVID could potentially have played into some of the more recent decisions. As the governor indicated, the work has begun thinking about continuity of those areas where we have some risk and using that as an opportunity to strengthen operations throughout the state agency. So nothing spiking at this moment in time, but we're obviously preparing for next June.
Thanks, folks.
The Connecticut Mirror.
Good afternoon. I'll share with you another time the look on Paul Mound's face, Governor, when you tried to not answer Ken's question. She said earlier that half the ICU beds are occupied. Do you have a sense for how many of those are occupied by COVID patients?
Who wants that? Deirdre?
Yes.
Josh?
Answer is 39 COVID positive patients in the ICU out of 232 total COVID patients, inpatients right now.
Okay, and excuse me, I think most of us on the call don't know off the top of our heads how many ICU beds there are. Can you give some context for the...
Yes. I'm surprised you don't know that number, Paz, off the top of your head, but there are just over 1,000 ICU beds in the state, adult ICU beds in the state, and as mentioned, 39 of them are currently occupied by COVID positive patients.
And you said, let me see, there's an availability of a quarter of all hospital beds. So my question is, for this time of year, what is quote unquote normal for availability of ICU and general beds in a hospital? No? Okay.
So I'll take a stab at that. I think as a general rule that occupancy level is probably on the low end. Hospitals, as the governor alluded to, healthcare utilization is still somewhat down, although it's rebounded back from where we were during the pandemic. So I think there are fewer elective procedures still being done, fewer elective admissions. So I think that number is probably a little bit lower. And it's certainly low for flu season, which we're not in yet, but it's probably a little bit low year over year.
All right, I'm sorry, I didn't mean to make those questions sound like we were playing college ball. But I guess what I was getting at is overall capacity for hospitals. And so if those are elective, I guess is the feeling that you can dial back occupancy in the hospitals if need be. All right. Okay. And then the last question, what's the 7-day rolling average at this point? I don't think you mentioned that.
Test positivity, the 7-day rolling average is 2.1%.
Okay. All right, folks. Thank you.
The Waterbury Republican American.
Thanks very much. I have a kind of a similar question to Ken about his phrase about getting granular. Waterbury was near the 15 per 100,000 mark last week. I did not look up, and I cannot look up right now, the numbers for Prospect, but that sort of leapt out. So what is the explanation, or if there is one, for the uptick in Prospect as well as Waterbury?
Yeah, I think, Paul, I'll start, and Deirdre, please add, but I think, Paul, when we're talking to the epidemiology team, you can see not just Waterbury and Prospect, but some of the surrounding towns that are in the orange as well, that there is some community spread going on in the Naugatuck Valley up through that area. So again, same explanations. Eastern Connecticut, we talked about Norwalk earlier. No major events or super spreaders to point to. A lot of community transmission that we're concerned about that has spiked up a little bit in that area.
Commissioner Gifford?
Yeah, the only thing I will add is that I think because there have been a number of these high-profile super spreader events, it's understandable that everyone anticipates that maybe that we can point to one of these when we start to see increases in cases, and maybe in some sense it's reassuring for people to know, oh, I haven't been to one of those events, and so therefore I'm safer. But the thing about this virus is that once it's in the community, just like I mentioned, once it's in a nursing facility, it's extremely contagious if people aren't vigilant with their masks and their distancing. So just a couple of cases, no matter how they're introduced into the community, if they start to spread from one to another, if people who are sick don't stay home, and if people who are exposed don't stay home, it just spreads very rapidly from person to person to person. So a super spreader event is not necessary in order to see widespread community transmission because it can spread efficiently. Unfortunately, about this virus, it can spread very efficiently in a community, even without one of those super spreader events.
Thank you. Did the mayors of Prospect and Waterbury indicate that they have made a decision not to roll back the third phase opening rules? Did they make any kind of indication of what they plan to do now that they're in this category?
I can take that. As the governor mentioned from last week's list, only Wyndham indicated that they would roll back. The new additions to the list, they have 96 hours to notify DECD about their decision.
Yeah, okay. I was just wondering if they might have said something today. Okay, thanks for that. And in terms of the hospitalizations, can you give us more on the demographics of the patients that we're seeing, the ages, races, anything you can give us to give us an idea of who is actually being hospitalized?
Yeah, I mean, anecdotally, Paul, from discussions we've had with leaders of some of the major hospitals, it's a very similar demographic to what we've seen throughout the pandemic. Tends to be older, although it's just slightly seems to be trending a little bit younger than in the spring. But in terms of most of the dimensions that we do, track this stuff, it seems to be pretty consistent demographically.
Okay, and just one more question. In terms of the nursing home staff testing, is basically all staff at all homes get tested again? If so, when did that start?
So we never stopped testing staff in nursing facilities. When we began testing staff back in the late spring, it was a question of whether we were doing it weekly or monthly. Over the last few weeks, when we've issued alerts in towns and in the entire county of New London, we've gone back to asking all facilities to test all staff weekly, test all residents weekly if there's any case at all among staff. And we're talking about how to enhance that even further across the rest of the state.
Okay, just to clarify, ask or require if there's a staff member who tests?
They're required to test residents if there's a staff member who tests positive.
Okay, thank you very much for that clarification.
Sure.
The Hartford Courant.
Hey everyone, this is Emily Brindley from the Courant. Governor, I'd like to ask a question for you first. You mentioned earlier this week, I think it was on Tuesday, our 3% positivity day, you mentioned that Connecticut is not an island, which kind of explains why we might be seeing this spike that we've been seeing right now. But then with the red alert towns, you're pushing for different restrictions on an even smaller basis than the state as a whole. So if the entire state isn't an island, can you explain the logic behind treating individual towns as islands? Yeah,
Emily. It does seem to me that in Danbury and other places, we've been able to bring in the rapid response team and on a municipality basis really make a big difference in terms of containing the virus. So I don't have to treat this on a statewide basis necessarily if I can target our resources where it's needed. But you're right when I said about an island. If we found that we were in a very different situation, much like you're seeing in Europe right now, I'd be talking to my regional governors, seeing what we should do on a broader basis, not just the state of Connecticut. But right now, I think we're talking about these flare-ups, and hopefully we're going to be able to keep them contained.
Okay, fair enough. And I also want to ask about, we've been seeing these numbers trending up for, it's about 6 times. And every time where those metrics kind of jump up again, you and your administration point to the spike and say that it's not something to be super worried about yet. So can you...
Sorry, Emily, we can't hear you clearly.
Yeah, Emily, your audio.
What's the time about where we are now?
Emily, your audio is cutting out.
Is it any better now?
It sounds all right now if you want to give it a try.
Okay. I was just asking, the positivity rate jumped above 1% for the first time back on September 9th. So it's been about 6 weeks of upticking numbers there. And every time one of the metrics ticks up, you and your administration say that the spike isn't quite big enough to be really concerned about yet. So can you tell me at what point would you actually feel worried about this? And after 6 weeks of rising numbers, how concerned are you now? I'm
concerned, Emily. Don't let me dismiss this. You're right. 6 weeks ago, we were 1%, and today we're in a 7-day average is over 2%. We've had a day at 3%. And I look what's going on around the country. I see states that have 20, 30, 40% positivity. I see my neighbors. We've got great neighbors here in Connecticut. We've been really able to keep a very low positivity rate for a long time. We've been, the rest of the country has looked with envy. And but we can't do that forever, and we're seeing this spiking up right now. So I take nothing for granted. I'm trying to remember exactly what was your question in terms of how those changes impact us.
I think you answered it. I really just was asking how concerned you are right now. And if I could ask Dr. Gifford the same question, just about, how much worry do you have now, and how much worry do you have for the next few weeks or few months?
I heard the governor say once that he was paid to worry, so I put myself in that category. It's kind of my job to be thinking about the future. The reason that we wanted to put out this alert map was because we want people in Connecticut to know what's going on in their town and their county, and to take action. A lot of this prevention of turning this around is within our own personal control. It has to do with our behaviors with one another at the workplace, when we're engaging in commerce. All of those things are going to help us prevent the spike that we saw in March and April, which is very much our goal, to minimize infections, and by minimizing infections, to minimize hospitalizations and deaths. And so the reason for us sharing these alerts and letting towns know, even if they're in the yellow zone, 5 to 10, that means you're higher than where we were just a month or two ago, as you point out. So now's the time to take action. Do what you can to help us prevent your town from going from yellow to orange. And if you've gone to orange, do what you can to get back in the yellow. And if you're in the red, let's all work together to do what you can to get your town back into the orange or the yellow, or hopefully off the alert list altogether. So, we don't, panic is not helpful in this kind of a situation, but action and well-informed strategic action is helpful. So I think we should all be concerned and then take the appropriate actions.
All right. Thank you all. I appreciate it.
CT News Junkie.
Thanks, Max. Hi, everyone. It sounds like from a statewide standpoint, we have the hospital bed capacity situation sort of at least under control. I was wondering, in these flare-up areas, though, are there any capacity situations in like the southeast area hospitals where we're having a lot more cases?
No, actually, somewhat to the contrary. As the governor mentioned at the beginning, fortunately, we've seen in the last week the cases in New London and in Norwich actually ticked down just slightly, so that's encouraging. And equally, the hospitalizations in New London County are also down slightly off their peaks, not dramatically, but at least not continuing to grow. So that's encouraging news. And one of the other important lessons that we learned back in the spring was that our hospitals work together very well, both the big networks, but even outside of their own networks, working with the other independent hospitals. They worked very well when we needed to transfer patients, to move resources and staff around, to load balance, essentially, when they needed. So it's actually we're a small enough state where we can have that flexibility. That means that even if one particular county was experiencing a surge in their hospitals, we could, leverage the capacity we have in other counties as well.
Okay, thanks. Governor, I was wondering, have you voted absentee this year? Are you planning on voting in person? What are your voting plans for this election cycle?
Yeah, I was going to vote in person. I've thought about that since I'm 66, but I just think voting is such an important citizen's obligation and right that I want to be able to go vote in person. If I can do anything to encourage people to vote, I want you to vote if you can by absentee ballot. If you can't, drop it off at the ballot box or go there and vote and socially distance. But that's the message I wanted to send. So I'll be voting on Election Day in person.
Okay. Any plans to watch the debate tonight?
Yeah. It's pretty good theater, and I thought the first debate was very revealing about two different men and their style and the way they approach issues. So I'll be looking to see if there's anything new to add.
All right. Thanks, everybody.
All right. I got to say, Deirdre and Josh, you did a lot of overtime work today. And Melissa and Paul, thank you. Obviously, there was a lot more concern about our physical health than economic health, but we were prepared to answer both questions. Look, a lot of the tone of the questions is a bit of here we go again. And I heard a amalgam word the other day. It was a combination of quarantine and eternity, quaranternity, something like that. Here we go again. And I know we're now moving into the holiday season. We've got Halloween in about 10 days and Thanksgiving thereafter. They had a chart they wanted me to read. I wanted you to see this of all the creative ways that people can enjoy Halloween. This is just one example. If you put your candy into the chute and it doesn't require it. On a personal basis, I love Halloween, and I love it as an old guy, and I love being there with those kids. And so this year, for the first year, we're not going to be able to do Halloween at the governor's residence. We are in Hartford, and it is in a red zone, and we do attract a crowd, and I say that with great disappointment. But that said, I want you all to be able to enjoy these holidays and do it safely. I know you've got to get that right balance. I've always had Thanksgiving, big extended family. The kids would bring a friend from all over. And I just had to tell them, this is not the year to do that. This is a year, I know you're kind of sick of the old man and Mom and just the five of us being together, but we're going to have to do that for this cycle. And but I say that to each and every one of you as we stay close to home, stay with your closest friends just for this next 6-8 weeks. I got to believe that we're going to be turning a page at some point here. And the more you can maintain that discipline, that quarantine eternity a little bit longer will make a big difference for all of us going forward in a bright new year. Thank you, everybody.